day. My name is Gasalanji Lamanta from BSN 11E. For today's video, I will be performing the assessment of cranial nerves 1 to 12. So first, for the pre-introductory phase, the first thing to do is that check the medical records of the client and as well as the doctor's order sheet if available. This is very important for us nurses. It's because you can determine or you can check if the medical records that a customer had before. So I have the medical record here in my end, and I will check for the doctor's order and the medical records of the client. After checking for the medical records, determine the scope of assessment needed. Next is prepare all the necessary equipment. The rationale for that is for you to administer or for you to perform the proper way and to have the right equipment on assessing the cranial nerves. And lastly, for this pre-introductory phase is that don't forget to do the hand washing. This is very important. It's because it will reduce the spreading of microorganisms to the patient or to the surroundings. And if necessary, do the gloving as well. So for the introductory phase, greet the client politely, introduce yourself, and verify the client's identity and how the client would like to call her or him during this assessment, and then build rapport with the client as well. So hi, good day, ma'am. My name is Gasalanji Lamanta, your student nurse for today, and for today, anyway, ma'am, what's your name? May I have your name, please? And your birthday as well?
Carol C. Gabriel and October 17, 2009.
Thank you so much for that one. Anyway, ma'am, what name do you want me to call you? Carol. Thank you for that one, ma'am. So next is after you introduce yourself to the client and to ask her name as well, explain the procedure to the client and how she can participate during this assessment. Provide the clients the opportunity to ask, to clarify, to raise any concern with this assessment. So anyway, now for today's assessment, I will be checking your cranial nerves 1 to 12. So I will be performing, or I will be doing some tests here in your eyes up to your feet. Would that be fine?
Okay.
All right. So is there anything else, ma'am? Do you have any questions or any clarification before we proceed on this assessment? That's wonderful. Thank you so much for that one, ma'am. Next is after you explain the procedure to the client, ensure the client's comfort, privacy, and confidentiality. Assess the settings as well. So, if this, are you comfortable, ma'am? Is this surrounding okay with you? Do you want me to adjust the lighting or the place or the seat that you have? Alright, thank you so much for that. So for the working phase, we will be assessing first is the cranial nerve 1, and that's the olfactory. So I will be asking the client to clear the nose to remove any mucus. Then I will be then close the eye of the patient, one eye of the patient. Occlude one nostril and identify a scented object that you are holding, such as coffee powder or bar of soap, and let the patient describe the smell. So good day, ma'am. For first assessment that we will be conducting today is your olfactory. So can you occlude or can you close one of your nostril, ma'am? Because I am actually holding the centered object here. So can you describe the smell for me? Alright. And then how about the other one, ma'am? Thank you so much for your participation. Next is for after the assessment of the cranial nerve 1, let's proceed to the cranial nerve 2, which is the optic. So we'll first check the visual acuity. So use an eye-held hand guard for the patient to cover one eye and read out loud the print. But we don't have any the held hand card as of the moment. So instead, we'll be using the patient's hand to cover the one eye. So can you cover your right eye now? Right? And I will be giving you this print. Can you read it out loud?
Business reply card. Samsung Media Alliance.
Alright, thank you so much. So next, after checking or after testing the visual acuity, let's go ahead and proceed on the visual field. So for the visual field, face the patient directly and ask the patient to look into my eyes, and then place my hands 2 feet apart, lateral to patient's ears. Slowly I will be moving my fingers until the patient identifies them. So I will be repeating that in the upper and lower quadrants. So can you stand up, ma'am? And then look into my eyes, not in my hand. Okay. So again, close your eyes with your hand. Don't look on my hand. Look into my eyes. Okay. And then I will be raising my hands and determine if how many fingers did I raise. Okay. Alright. So just look directly into my eyes, and then how many is that? 2, 4, 5. Next, on your other eye, again look directly into my eyes, not into my hands. Okay. All right. Next, same procedure. 1 and 4. Then how about this? 2. All right, that's great. So thank you so much for so after assessing assessing the visual fields, let's go and proceed to the cranial nerves 3, 4, and 6. So that's the oculomotor, trochlear, and abducent. So for assessing the cranial nerves 3, 4, and 6, that's the oculomotor, trochlear, and abducent. So first thing to do is check the upper eyelids while the patient is looking directly at you. The eyelids should not obscure the vision. So ma'am, can you stand straight? Can you sit straight, ma'am? I will be checking your eyelids. Alright, next, after checking, inspect the pupils. They should be around and equal in size. Then, after that one, after checking the pupils and the eyelids, if it's symmetrical or if it has an equal size, check the pupillary reaction by shining a light in the pupil, and I will be observing for the direct and consensual reaction. I will be checking the pupillary reaction by lighting the eyes of the patient. So first, Next is the other one. So next thing to do after the popular reaction, hold your finger. I will be holding my finger about 10 centimeter from the patient's eyes, and observe for pupil dilation while asking the patient to focus on my fingers and a fork. So good day, ma'am. After I'll be testing your papillary reaction, I will be testing if your pupil will be dilating. Okay. So can you focus on this one, ma'am? Focus on this. Just right here, ma'am. Don't look on any other objects. Just look onto this, to my hand. Okay. So next is the after checking if the pupil will, or after observing the pupil dilation, check as well the extraocular movements. So I will be using the 6 cardinal directions of gaze, and I will be standing 2 to 3 feet in front of the patient and ask the patient to follow my fingers as I make a wide H. So I will be performing this extraocular reaction, ma'am. I will be determining, or I will be testing your extraocular reaction. So can you follow my finger, and I will be performing the H test. Okay. Just follow my finger. Everything's after the age, after performing that, as I can observe that it's normal. Her eyes is actually looking symmetrically. So for the next assessment is the cranial nerve 5, which is the trigeminal, and this is the mandibular, maxillary, and ophthalmic division should be tested symmetrically for pain, light touch, and temperature. So for the cranial nerve 5, for the corneal reflex, I will be checking that to my patient. I will be asking the patient to look up and away from me, and I will approach the patient from the side out of her line of vision and lightly touch the cornea with a fine wisp of cotton. And this is the wisp of cotton that I have here, and I will be performing the corneal reflex now to my patient. So I will be checking that the corneal reflex using a wisp of cotton. So next is the other one. So after that, assessing the cranial nerve 5, which is the trigeminal, next is we will be assessing the cranial nerve 7, which is the facial, the acoustic vestibular ocular, and then first is I will be assessing the facial, which is I will be standing in front of the patient, and I will ask the patient or the client to smile, frown, show teeth, puff cheeks out, purse lips, raise eyebrows, and then close eyes tightly against resistance. So normally the patient could do this maneuvers easily. So ma'am, for the cranial nerve 7 on your facial, can you raise your eyebrows? Alright, thank you. And then can you puff your cheeks? First your lips, ma'am. Can you show us your teeth? Okay, that's number 2. Alright, after that one, after informing or after performing that test to the client's facial, next is we'll be checking the hearing or the hearing of the patient. So I will be testing one ear at a time and occlude one of the patient's ears with my finger. So I will be standing 1 to 2 feet away from the patient and conceal my mouth to prevent leaf reading, and test the open ear first by whispering numbers of words that contains equally accented syllables such as 99 or baseball. Ask the client to repeat what you have whispered and repeat on the other side. So I will be occluding your ears one at a time now, and I will be whispering a word here. So after I whisper, can you say it out loud? Alright, so first, can you speak properly? Okay. So I will be occluding one of her ear, and I will be whispering the words that I said earlier. One. Alright, perfect. Next one is I will occlude the other ear.
99.
Alright, perfect. Thank you so much for that. So next is that after assessing the hearing of the patient using those method or technique, I will be assessing as well for the lateration. So I will be performing the Weber's test. I will be using a tuning fork and place the base of the vibrating tuning fork at the top of the patient's head. So I will be asking if the sound is louder in one ear or same in both ears. So since I don't have that kind of materials, or I don't have that kind of equipment here in my house, my alternate way, or my alternate material here or the equipment is this one. So let's just pretend that this is a tuning fork. So I will be testing you now the Weber's test. So there's a vibration here, and I will ask you if you can hear it both in your ears or in just one ear, which is louder. Okay. So there's a vibration now. Can you hear it can you hear it using your 2 ears? Alright, perfect. So again, I will be performing so that I will determine, or just to make sure if I got it correct. So can you hear any vibration, ma'am? Did you hear it with your both ears? Alright, perfect. So after performing the Weber's test, let's proceed on the Renee test to compare the air and bone conduction. So I will place a vibrating tuning fork on the mastoid process behind the ear. When when the patient indicated that the sound is no longer heard, quickly place the vibrating tuning fork near the ear canal. Be sure to also check the opposite ear. So after the Weber's test, now I will be performing the Renee test. I will be placing this back to your mastoid process, or back into your ears, and let's see if you can hear the vibration. Okay. Alright. So did you hear anything now? No. Did you hear anything? Just wanted to make sure. Yes. Okay. So that's actually a good sign. That's a normal sign, or normal findings when performing the Renee test. So let's try again. Try on the other ear. Can you hear any vibration now? Is it louder? Yes. Alright. did you hear any um, sounds or vibration, right? Okay, that's amazing. Thank you so much. So after assessing the cranial nerve 7, I will proceed on performing the cranial nerve 9 and 10. And that's the classopharyngeal and vagus. So I will be asking the patient to say ah and assess the patient's voice. Is it hoarse or does it have a nasal quality? So after performing that, we'll be observing the soft palate and the uvula. So the soft palate should rise promptly and symmetrically, and the uvula should remain at midline. So inspect as well the anterior and the posterior pillars of the pharynx. So I will be using this one instead because I don't have the tongue depressor here in my end. But let's just pretend that this is a tongue depressor. So, and remember that we're almost done here assessing all of your cranial nerves. We're actually at the bottom right now. So I will be assessing your glossopharyngeal pharynx. Glossopharyngeal pharynx. So can you open your mouth, ma'am, and say ah, please? And I will be inserting this sound depressor. Okay? Okay, so I did check as well that all of her, her soft palate is symmetrical and it did rise promptly. And for the uvula, it's actually remain in the midline. So next is that this is for the cranial nerve 9 and 10. Again, I will be testing the gag reflex one side at a time using a tongue blade, and after warning the patient, stimulate the back of the throat lightly on each side in turn. You should see a rise in palate and other signs of gagging. Ask the patient to swallow. It should be done without difficulty and regurgitation. So again, ma'am, I will be inserting the tongue depressor, and I would like to warn you, ma'am, that I will be touching touching your throat. Okay. So, alright. Can you ah? Ah. Then swallow, ma'am. Alright, perfect. So for after assessing the cranial nerve 9 and 10, let's proceed to the cranial nerve 11, which is the spinal accessory. So I will open the patient in the gown to reveal the upper trapezius muscles. Ask the client or ask the patient to shrug his shoulders upward against your hands. Evaluate the strength and the contraction of the upper trapezius muscle. And after, ask the patient to turn his head on each side of your hand and observe the contraction and the opposite cleidomastoid muscle, and notice the force of the muscles against your head. So right now, I will be this will be the second to the last assessment, and this will be your cranial nerve 11, which is the spinal accessory. So I will be placing my hands upward into your trapezius muscles, and then can you shrug, ma'am? Can you shrug? Alright, perfect. And then can you look in this side, ma'am? Can you move your face in this side? Next, can you move here, ma'am? Okay, perfect. So next, after doing that, let's proceed to the cranial nerve 12, which is the last assessment, and this is the hypoglossal. So I will be asking the patient to open her mouth and assess for tongue atrophy and fasciculations. After, I will be asking the patient to stick his tongue to his to stick his tongue out. Note for any asymmetry or deviation from midline. So the tongue should be protrudes straight out. So this will be the last part now for assessing your cranial nerves, and this is the cranial nerve 12, which is the hypoglossal. So I will be checking your tongue now if it's symmetrical, and if there's any abnormalities in your tongue. Okay. So can you stick out your tongue for me now? Out of your palate. Can you move it to your right side? Okay. And then on your left. Alright, perfect. Thank you so much. So we're actually we're already done assessing all the cranial nerves in 1 to 12. So anyway, ma'am, thank you so much for your participation throughout this assessment. Again, for the as I observed, ma'am, everything's good. You do have a normal. There's no abnormalities to from your cranial nerve 1 up to your cranial nerve 12. But your own physician or your own doctor will be explaining it to you the assessment or the results with the assessment that we did earlier. Okay. Alright, so thank you so much, ma'am, for your cooperation. Again, my name is Gathon G. Lamenta, your student nurse for today, and have a great day. Thank you. So that's my video for today. That's the assessment of the cranial nerves 1 to 12. Again, my name is Gathon G. Lamenta from BSN 11.